Good afternoon and welcome to YW Live Lunch and Learn, the Civic Engagement and Public Education YouTube live show presented by YWCA Hartford Region, where our mission is to strengthen families and communities. I'm your host, Adrienne Cochrane. Today, we are addressing one of the most urgent issues facing Connecticut families and public health leaders: the combined impact of federal funding cuts and the government shutdown, which began on October 1st, 2025. The One Big Beautiful Bill, signed into law on July 4th, 2025, introduced sweeping reductions to programs that sustain everyday life: healthcare, nutrition, childcare, housing, and education. These changes, compounded by the ongoing state shutdown, have forced every community and department to rethink how to safeguard essential services. So our question today: how do we preserve and protect public health when both federal and state systems are under unprecedented strain? To explore this, I am honored to welcome a woman whose leadership and voice have become synonymous with compassion and courage, Dr. Manisha Juthani, Commissioner of the Connecticut Department of Public Health. Dr. Juthani is the first Indian American to serve as commissioner in Connecticut's history. She previously served as professor of medicine at Yale School of Medicine, where she led the Infectious Diseases Fellowship Program from 2012 to 2021. A graduate of the University of Pennsylvania and Cornell University Medical College, she completed her internal medicine training at New York Presbyterian and served as chief resident at Memorial Sloan Kettering Cancer Center. Wow. During the COVID-19 pandemic, she became a trusted public voice, helping to guide Connecticut through crisis and into recovery. As commissioner, she continued to focus on preserving and protecting core public health principles and services, ensuring that every Connecticut resident, regardless of zip code, has access to safety, prevention, and care. Commissioner, welcome to YW Live Lunch and Learn.
Thank you so much for having me here today.
It is a pleasure to have you. So we'll jump right in to question number one. So we're now in the fourth week of the government shutdown. For those who may not fully understand the scope of your department's work, can you explain what Connecticut Department of Public Health is responsible for and what particular functions are most affected by the shutdown?
So the immediate function that was impacted immediately with the shutdown was our WIC program, or Women, Infants, and Children program. For those that are not familiar with the program, this is a program that helps feed women, infants, and children in our state, over 55,000 right now. And
55,000.
55,000, yes. And we have about 30,000 children, about 11,000 infants, and 11,000 moms who are supported by this program. And this helps support breastfeeding supports, infant formula, food. These are all healthy options that moms and kids can have. And they are such critical supports in those early stages of life, because we all know that it is the developmental years that really set the trajectory for children forever. And we were having about 5 days worth of funding left when the shutdown happened, because the WIC program is always in the discretionary line item budget that needs to be passed every year by Congress. There are certain line items that are mandatory spending. Those spending streams are consistently funded. They do not require Congress to pass a budget every single year. But WIC is one of those items that need to be passed every single year.
I see.
Now, we've been fortunate because we did get an infusion of federal funds that let us sustain through the month of October, and now we got an additional support to get us through mid-November. And the governor also stepped up and said that the state would support this program should we not get federal support. Of course, we don't know how long we'd be able to do that as a state, but that was the biggest program that was at risk in this time period. The Department of Public Health is 80% federally funded in general. However, a lot of our other funds are still available for now. The more weeks that go into this, the more we'll start feeling the impacts even more.
So that's really interesting that we're sort of on a collision course with a lot of things. And so I'd like for you to talk a little bit about just the level of devastation. I don't know any other word that makes sense to use in this time. What happened for families? You can go until mid-November. What would happen if you couldn't? Because we're looking at another side of this where SNAP benefits are set to basically sunset, in just a couple of days, literally. What would have happened had you been in the same situation with the WIC program and other similar programs?
If we didn't have the additional infusion of funds, luckily we are in a state where the governor was willing to support women,
That's
infants,
great.
and children. And so I think we would have been okay for some period of time. But again, there are a lot of competing demands.
That's
As you
right.
mentioned, with November 1st, SNAP benefits coming to a head,
Yes.
there are going to be very difficult choices that the governor and the legislature are going to be looking at as we are going into this shutdown longer and longer. Now, the Department of Public Health primarily does not provide direct services. A
Yes.
lot of the work that we do is prevention.
Yes.
It's cancer screening, it's screening for high blood pressure, and screening for diabetes. And so the work that we do, whether it be tracking infectious diseases, keeping our nursing homes safe, making sure our drinking water is safe, they're things that happen behind the scenes. And so people may not feel that direct impact in the same way that the social supports that the Department of Social Services, for example, as you said, SNAP benefits
Yes.
coming to a head, that's something you can feel right away. But the WIC program is one of the programs that we run that if we did not have funding for,
Yes.
we would have women, infants, and children that potentially could be going hungry. And that would be a dramatic impact.
Absolutely. All of this is so sad and I'm sure hard to fathom, much less talk about. So thank you, though, for joining us today to talk about these things. So many are calling this a dual public health emergency, and I think that we can see why. You have a shutdown, it's collided with the bill. I have a tough time with big, beautiful bill, but the bill. And so, what are the short and long term strategies that perhaps you're looking at in your department? And how to sustain and what does sustainability even look like and for what period of time?
We've been going through this exercise, honestly, since January when we realized the direction that this administration was going to take as it relates to public health. So in March of 2025, we had $150 million cut, 1 day retroactive. So our Attorney General's office with 23 states together filed a lawsuit. And we were fortunate that the $150 million that we were going to lose, that a preliminary injunction put in place the ability for us to be able to use those funds again. And those funds will expire in May of 2026. So there was going to only be another year and a half on those funds anyway. But then there are larger scale cuts that we have been anticipating and trying to plan for. We've been using Project 2025, the president's budget, as a roadmap for where we think this administration is going and where we have to be prepared that we may have to try to do the best we can in public health without the same funding that we've been accustomed to receiving to do that type of work. And so part of the exercise that we've been going through is looking at what are the core functions we must do as a health department?
Yes.
What are we statutorily required to do? And then what are maybe some of the nice to have things to do, which breaks my heart to say that they're just nice to have.
Yes.
Because
Yes.
in fact, all of public health is important. But if we don't have discretionary funding to do everything in public health we want to do, we're going to have to limit what we can do based on what funding we have to support the kind of work that we can do. So that is some of the exercise that we've been going through and trying to think about how we are going to battle the challenges that we have with large-scale problems, whether it be vaccine hesitancy and figuring out how to communicate to the public which vaccines are recommended to take, why do we think that they're important to take, and at the end of the day, it is at the discretion of a family to decide what is going to be good for them. But trying to break down through some of the noise that's out there and fear that is honestly out there, and even people who have a lot of information at their fingertips are starting to question, because there's a lot of information out there that makes you think twice.
That's right.
And makes you wonder if what you're hearing from the state health department, from your own doctor, is something that you should trust.
That's right. You are so right on that. And so given that, which is its own huge issue, big ugly issue, we'll say, how are you protecting? You mentioned a little earlier about seniors and nursing homes and understanding that staffing, inspections, things that have to be reduced. What level of comfort can you provide, and what are you advising, perhaps, as it relates to our seniors in these types of facilities?
So this is a real issue right now in the shutdown, too, because our facilities, nursing homes, as you mentioned, we get support from the federal government through CMS, the Center for Medicare and Medicaid Services, to do inspections of nursing homes. And right now, because of the federal shutdown, we cannot do inspections and cite federal regulations where nursing homes may be out of line. And so what we are doing is we have redeployed our staff to be able to do state-only inspections. So only using state dollars to do the inspections that they can do. Now, when staff go out, they are investigating complaints, and quite frankly, we have had a backlog of complaints ever since COVID, and there has been a lot of turnover in the nursing home industry. We have newer staff, newer personnel, and so with that, there have been an increase in complaints. People are getting used to new jobs, new systems. So there's plenty of work for us to do, even without the federal support. We've also, as I said, have had the backdrop of a governor who's saying that he's willing to support those inspections should we need to do them with the support of state dollars. But again, you cannot supplement all the support that we get from the federal government. It's just not enough in a state budget to be able to do that. And too many agencies that have too much need to do everything we need to do. So we really do need the federal government to get to a resolution, hopefully sooner than later, without cutting too much more from the supports that people in our state receive.
I always wonder, and so much conversation around, do people really realize just what this is creating, the domino effect of it all, and that people are afraid? You know, we get here at YWCA Hartford Region, we get calls and questions about things that are beyond our expertise, but we always know how and where to refer. But we don't want to overwhelm departments that are already struggling with something that really is through no fault of their own.
That is some of our experience as well. We get calls from members of the public. We are in service to the public. That is our job as state agencies. Sometimes it's not our agency. Sometimes people think maybe it's the Department of Public Health, but we try to refer them to the appropriate agency if it's not us. But one of the challenges is the limitations we have right now. As I said, we are an 80% federally funded agency. We have been given specific guidance from CMS that we cannot use our surveyors to do federal inspections right now in nursing homes. So we are limited on the number of things we can cite on nursing homes. And then when we do come back online, I can only imagine that there will be additional work to do because, quite frankly, people are continuing to live their lives in these homes and things are continuing to happen. So there's only going to be a backlog of work to do once that does come back online.
It's so important for you to make this point because people are not realizing. They'll say, oh, they're just not, public health isn't, oh, they're not coming out to do it. Oh, they don't care about us. They don't recognize what this situation, the restrictions that this situation places on you as the commissioner and your staff. I think it's really important for the public to understand You're doing all that you can legally do under the circumstances that we're facing now.
And I appreciate you highlighting that because we have a very dedicated staff that is really committed to ensuring that our elders who are living in nursing homes in particular are cared for safely
Yes.
and efficiently, effectively, and with care. And they can only do the state regulated part of their job right now. We can't even do the part that is paid for by the federal government because we've been given these restrictions by the federal government.
Commissioner Juthani, because I think that's so important, will you say that again? Make that point again so that people do understand. You're not, your department isn't, your staff isn't what's failing them.
That is absolutely correct. If we had the ability to go out and do our full jobs, which is what we want to do.
Of course.
Many of our staff are partly federally funded and partly state funded, so that when they go out to do to do an inspection of a nursing home, they can cite federal regulations where appropriate, and they can cite state regulations where appropriate. Right now, we can only cite state regulations because that's what we've been very clearly told is all we can do, and we've been told that we are not allowed to do otherwise. So this is not some sort of choice that I have made or that I've
Absolutely.
instructed my staff to do. This is something that is coming from the federal government, and we have to abide by those terms because that is what ultimately pays for people to do this work in nursing homes.
Yes, and the repercussions that you would face. So you've got the possibility of being shut down altogether because you're violating federal law. You're not supposed to be doing this. You're doing it, and that shuts you down completely. Now you can serve no one.
Absolutely.
And that's not a great choice.
If we were out of compliance, that's not something
Yes.
that we want to be.
Absolutely, absolutely. So we've talked about seniors and what the impact is. Could you say a little bit more about vaccination, some of the other areas that your department covers, just what is happening or what can happen during this period?
One of the things that has been very troubling to me is the conversation around vaccinations and the challenge that it poses to the public in terms of trying to weed out the noise, figure out who to trust, understand who to listen to, and teasing out science and data and trying to figure out how to make the right choices for yourself, your family. And let's take the respiratory viral disease vaccines that we think about every fall. So we have a yearly flu shot that I recommend for everybody.
I
6
take my
months and
flu
older.
shot every year. My dad practiced in public health, and he told me if I take the flu shot. So I do.
I love that. I love that. And I love that you're sharing that personal story with others because I think it's really important. You know, we know that the flu shot may not 100% protect you from
Absolutely.
getting the flu, but I will tell you that it will protect you from maybe the duration that you have the flu,
Yes.
maybe the severity that you have the
Yes.
flu, the ability to transmit it to others may be reduced.
Yes.
So there are many benefits even if you get a mild case of the flu.
That's right.
If you don't even know you have the flu and you had a scratchy throat for the day, that's a benefit. That's a win of the shot.
Absolutely.
So similarly, the COVID shot, the data are actually quite similar. And I know that people have a lot of hesitation since the pandemic.
Yes.
People were eager to get those shots in the beginning as a way to get out of the pandemic. And one of the things that we see in science, and science has evolved, there's a lot that we learned in COVID that maybe we wouldn't do the exact same way the second time around if we were to have gone through the pandemic again with the knowledge we have now. But the reality about COVID is that similarly, the COVID shot may not prevent you from getting COVID, but it does prevent the severity of disease. It does prevent the duration of disease.
Yes.
It helps protect other members of your family, our younger and our older,
That's right.
who are at most risk from both flu and COVID.
Right.
And there's been a lot of information that makes people feel like maybe it's not worth it to
That's
them
right.
to get a COVID shot.
That's right.
But the reality is, I still do think that for everybody 6 months and older, it is a benefit to get the COVID shot. It is of utmost importance for our older adults.
Absolutely.
And honestly, for our children, the next group is that 6-month to 2-year-old age group. Because those are the two groups, the youngest ones haven't seen COVID at all.
Right.
Remember
That's
what
right.
it was like when we were first exposed to COVID the first time. A lot of people had really severe disease.
Yeah.
Our youngest kids, that's the group they're in. Our
That's a great point.
yeah, they
actually.
haven't
Yeah.
seen any COVID. And, you know, have we all built some immunity because of the years that we've been around the virus? Sure. But immunity wanes with time.
Yes.
And that's what the benefit of getting at least a yearly shot is about.
Yes.
Is about reminding your immune system. And, you know, the COVID shot is really, whether you use the mRNA shot, so that's that
Yes.
Pfizer and Moderna that a lot of people heard about. Some people may have stories or things that make them concerned about that. I don't have concerns, but you know, people may hear things that make them concerned.
Yes.
There is another vaccine called Novavax. That is an older, sort of more traditional vaccine methodology for many other vaccines that people have received. I got that shot last year, and I actually got less side effects with it, so that was a benefit. This year, I got even a newer shot, which is the newer Moderna shot, which is a smaller version of the vaccine than in prior years of the Moderna vaccine. I got less side effects with that. So, you know, I think that knowing that there are other options, you know, whatever your hesitation may be, I still do think that there is a benefit to both these shots going into this respiratory viral disease season. But I do know that people have a lot of concerns about a number of viruses and a number of vaccines.
Yeah.
And what we're hoping to do is be a state where you can at least trust the information coming from the state health department, I hope. But if you don't, take that information to your doctor.
Right.
And talk about it with your own doctor. Because at the end of the day, that's who's going to help you make decisions that are good for you.
Yes.
And I would never try to take the place of somebody's individual doctor. What I do try to do, though, is get as much information out there so people can think about the various choices they have and then mull them over with somebody who knows them personally.
But that's important. And you did something really special a couple of minutes ago. And I don't know if you realize it or not, but you said you're a scientist, well educated, well versed. And you said, I take the shots.
Yes.
So it's not the idea of we're telling everybody else, you ought to get this shot, you ought to get that shot. And you yourself are not practicing what you're preaching. And I think that's something important. It helps to debunk these stories. Some of the stories are so ludicrous, I almost can't even entertain them. The thought that, well, we're trying to inject something strange into people to create something, it's the government doing whatever it is.
Right.
Of course, you always have to do your own research.
Sure.
Be educated yourself and understand if something makes you feel a certain way. For example, the flu shot. People, well, I took the flu shot and I got a cold or I got sick, or you're injecting the virus that causes influenza into my body anyway, and not recognizing also that it takes a couple of weeks to even take effect.
Right.
And I will tell you, the very first time I had a flu shot, I didn't always do it.
Yeah.
Very first time I had a flu shot, I thought, oh, my dad, this is terrible. It'll get better. It's not as terrible as if you end up in a hospital.
Exactly right.
The hospital is no place for sick people.
Yeah.
That's just not where you want to be. You want to stay outside of that. And I will tell you, in the subsequent years, I always wait into September, 1st of October. I want it to last the entirety of the season. And when we're in communal environments, it's really important. You look around at colleagues, everybody's out, everybody's sick.
Yeah.
Now, you may get something, a scratchy throat. I don't know that we can even keep up with all the viral infections. You know, I don't know that modern science can keep up with everything that's coming, but something that makes your chances better, that you will recover quickly at home, as opposed to maybe becoming hospitalized or something more serious. And so I certainly say that everybody has the right to make the decisions they need to make for their family, but I really think people need to be themselves educated and not just see what's on the dark web or just listen to somebody else's experience, because all of our bodies are different. I love to talk about this topic because I debated it for years with my dad. I did for sure do that. But moving along and talking about just, again, we're in unprecedented times and circumstances all around us. How is your staff? How are those healthcare workers, and what are you hearing from them in terms of how they're dealing with everything that's going on right
You know, it's very, very challenging right now in two respects. One, for healthcare workers and for public health workers. Now, public health workers, a lot of times people don't know who they are because they're behind the scenes.
That's right.
They're surveying the nursing homes, as you mentioned, or hospitals. They're making sure our water supply is safe. They're nurses in vaccine clinics giving immunizations to children and to older folks. They're people doing all kinds of work behind the scenes, or maybe doing blood pressure checks or doing finger sticks to see if screening for diabetes, things like that, running big programs. And then we've got our healthcare workers who are in our emergency departments, who are in our federally qualified health centers, or in other clinics. And one of the challenges that's happening right now is that the fundamental basics and foundation of science are being questioned.
Yes,
Now,
they are.
the science that helps inform how we take care of people and provide health care is the same science that is involved with how we develop large-scale public health interventions that help prevent people from getting sick in the first place, like vaccines.
Yes.
That's just one example of a public health intervention. There are other public health interventions. Seatbelts are a public health
That's right.
intervention.
That's
They
right.
help prevent people from dying in car crashes. We have many, many such public health interventions that may not be quite in the health care space. But what I hear from healthcare providers who are in facilities is that people are coming in with questions. And questions are fine. Of course they're fine.
course.
That's what our job as healthcare providers is to help answer people's questions when they have them. But when you respond with scientific answers, sometimes those are being questioned in a way because maybe they don't align with some of the other narratives they are hearing publicly. So, for example, there is no evidence that ivermectin is a treatment for COVID. When COVID first came into our world, we tested lots of different types of medications to see if they could work because we were looking for anything.
Sure.
And there was no data to say that ivermectin works. I just spoke with a colleague, a physician, who told me that he had a patient that demanded it
Okay.
for the treatment of COVID.
Wow.
And he had another provider who was upset that he wouldn't give it.
Wow.
Now, we have states around the country that have passed laws allowing for over-the-counter ivermectin, so people who want it can get it for the treatment of COVID. This is an anti-parasitic drug. Drugs have toxicities.
Yes.
No drug is without the potential for side effects.
Absolutely.
And my general advice on any medication is if you don't need it, don't take it.
That's right.
If you do need it, take it understanding what the potential risks may be, but most likely the benefits are going to outweigh the risks.
Yes.
And if a physician is recommending it to you and you trust that physician, then that makes sense. But if a physician is specifically not recommending it to you,
That's right.
I would also take that into consideration.
There's a reason.
There's a reason.
There's a reason. Yeah, we shouldn't assume they don't know anything about it. Maybe they think it's not quite right for you.
Right.
Thank you so much on this. So, Commissioner, you have led through COVID, now through this fiscal crisis. What are some of the principles that sort of guide your work, guide how you move during this time?
You know, I think if we think about what we're going through right now as an existential crisis, it becomes overwhelming. It becomes something that does not feel controllable. And different than COVID, where we felt like once we have vaccines, there will be a path forward.
Yes.
And that didn't happen immediately
Right.
because we knew that the virus kept mutating, but we knew we had tools at our disposal to try to mitigate the harms and get back to normal living at some point.
Yes.
The problem right now is we don't know what the end is going to be, and we don't have it in sight. That can be a very demoralizing perspective.
That's right.
But I, by nature, am more of a hopeful person. And I'm
That's good to
somebody,
know.
yes, and I'm somebody who likes
Good to
to
know.
live in day-tight compartments and control the things that are within my control.
Yes.
So what I mean by that is that we all have agency on certain things. We all have control over certain things. And what we can do is try to have an impact on the things we have control over. The things I do not have control over are not worth years off my life.
Right.
Because quite frankly, I will age very rapidly if I let that happen.
That's true.
And
That's true for
I'm-
any of us.
Yeah, for
Yeah.
any of us, exactly.
Right.
Which is why this is the advice I'm giving to others as well, and others that are in my department and people that I work with. Because at the end of the day, all we can do is control what is within our control.
What I can control. That's
What
right.
we can control. And if we do that, then we can find small wins. And we can say, we had this conversation together today. And maybe somebody heard something we talked about and maybe took an action that helped them.
We hope so.
Or maybe used it as at least a moment to feel uplifted, that there are people out there trying to do things in our state to help advance the health of our state.
Yes,
I cannot control everything that's going to happen in this country,
of course.
but I can at least try to control, to the extent that I can, with the resources that I can, what is happening in public health in our state. I'm also trying to use this as an opportunity to say, we weren't doing everything perfectly. We all know that. That's never the case, that everything is
No.
perfect. I know areas that we can do better, and I'm trying to use this as an opportunity to introspect, reflect on our organization, think about how can we put the money that we have, the resources that we have, the people that we have to work in areas that can really help control something in our state. And I'll just give you two examples also of that. So for example, we have an Office of Firearm Injury Prevention, preventing gun violence in our largely cities
Yes.
throughout the state. We've had 18 different community partners that have been funded through our program. Millions
18?
of dollars, millions of dollars have gone into community-based organizations that are doing work right here in Hartford and in other cities around the state. And we can see the benefits of what is happening right on the ground. That is state dollars, Connecticut community-based organizations. We didn't have support from the federal government to make those realities come to fruition. That's a win. I can look at that and say,
Absolutely.
we're doing something here right in Connecticut.
Absolutely.
We have an investment from the Tobacco Health Trust Fund. Again, that is money that came to the state. It is state dollars. We're looking to invest in our quit line, in resources throughout our state to try to get as many people to quit smoking as we can and try to prevent young people from start vaping or
yeah.
quit vaping.
Yes.
So there are these types of initiatives that are really within our control. These are big public health initiatives. They are funded by state dollars. Even though we are an 80% federally funded agency, we can do things just with the work of the legislature and the governor and people right here in the state of Connecticut to make sure these big public health problems still are being addressed.
So we're not coming to a screeching halt. There's some things that you have restrictions and limitations on, but there are a whole lot of other things that you can continue the movement forward on. So
That's exactly
great.
right.
Yeah, I'm so happy you talked about that
Yeah.
because I'm not even sure that I knew that. 18 different agencies, right? That
That's
are
right.
supporting that.
Yes.
That's wonderful.
So there's a lot of work happening, and the Department of Public Health is very broad in our
Yes,
scope. It's
yes.
very, very broad in our scope. And people don't think of the fact that if you walk into a hospital or a nursing home that you're getting safe, quality care. That's because we regulate facilities and
Yes.
practitioners
Yes.
and emergency medical services. People don't think about the fact that when you turn on the tap, your water is safe. Again, that's because we regulate the water companies that help make sure that that water is safe. When we think about infectious disease surveillance and vaccinations and knowing what diseases are even going through our community, our infectious diseases group is monitoring that on a regular basis.
Yes.
Ensuring food is safe, that food is not infected. These are basic public health things that happen in our communities that people often don't realize
Don't
are
even
happening
think
in the
about
public
it.
health department.
That's right.
They're taken for granted in a developed society.
No, that's a great point, too. I'm sure they're assuming, well, the hospital is doing this or this doctor's office is doing that. They probably don't even see the
People
place
don't
in
think
public
about
health.
the fact that we have 59 local health departments that are charged with making sure that all our restaurants are serving safe food. That's
Now,
not something that
right.
just happens.
That's right.
Those
That's
restaurants are
right.
being inspected. There are people that are going in. We, as the state health department, provide technical assistance to those local health departments that are doing that on the ground. When there's an outbreak of listeria or Legionella or Salmonella or E. coli or some of a variety of infections, norovirus from a given restaurant, or
Yes.
we do the outbreak investigation. We evaluate, where did this come from? What needs to change to make sure that doesn't happen again? Again, safe food, safe water, people don't think of that as a public
You're
health
right.
achievement every single day. Public health is saving people's lives every day, and they don't even
Don't realize it.
realize it because it's taken for granted in a developed society.
That is an excellent point. And I was going to ask you to list beyond the vaccinations and the obvious some of the things that you are responsible for and that your department is responsible for. And you just did that. So are there any others that maybe people don't think we do that, or do you think, I'm sure the list isn't exhaustive, but there are other areas that would I will think differently.
There are so many areas. I'll give another example,
Great.
which is when you think about a hurricane, some sort of natural disaster. Often people are thinking about emergency support that might come in to lift a tree or take care of the roads. What if that road is going to a hospital? What if the hospital is out of power? What if the nursing home has to bring somebody who's sick to a hospital,
Yeah.
but the road is closed? Whenever there is a natural disaster, the Department of Public Health is at the ready, and we are doing planning for emergency preparedness all the time. You cannot do that in the moment. That needs to be done in
Planned in-
advance.
yes.
It needs
Yeah.
to be planned in advance. What if water
Absolutely.
goes out? How are you going to supply safe water to a hospital, to a nursing home? What if
is
the
true.
power goes out? How are they going to be on backup generator? Because of our regulatory authority and our partnerships with hospital and healthcare systems, that's part of the way that we ensure safety even during a crisis. And largely, that is the safety net of the healthcare facilities that people assume they can go to if they needed it
Right.
in such a catastrophe.
So another example of boots on the ground first responders, and maybe the public not even realizing you are.
That's right.
Those are great examples. As we come near the end of this very interesting conversation, I do want to ask you how you balance transparency with still maintaining the public confidence.
So my goal is always to try to be as truthful as I can and let people know what I know when I know it. So obviously within some constraints, we are a
Yes.
regulatory agency.
Yes.
I'm not free to share everything that we do know. But as it pertains to people's health, what I try to say is, with the information we know now, this is what I recommend. And hopefully people can understand that science does change, and experience often teaches us more. And sometimes with that, our recommendations do change and evolve. But what we try to do is try to establish trust, try to show people that I'm certainly not in this job for the money or the notoriety.
Right.
It's because I have a fundamental belief that government and public service is the utmost we can do to serve people.
Yes.
People are entitled to health. That is a basic human right. And what we can do as a government is try to give people the information that they can use to make decisions. And sometimes that information changes. And COVID, unfortunately, showed us that a little bit. And some people felt a little bit disenamored by what happened in COVID. What I tried to do through the pandemic was to say, this is what I know right now.
Yes.
And I'm not trying to be dogmatic. or tell people what to do, but I can tell you that this is what we know now. And I've tried to maintain that level of transparency because ultimately that is what people then trust you for.
Yes,
If they
that's
feel
right.
that you genuinely care, that you're doing this for the right reasons, and that you're giving them information with the best information you have. And I think most people do that with their own individual doctors.
I think so.
Most of the time, people
so.
realize that their individual doctor is trying to make the right decision that they can for them and advise them accordingly. And sometimes they're not right, but they made the best choice they could and the best recommendation they could in that moment. And most people understand that. Most people do understand that. I understand that
think so.
sometimes even that's difficult to swallow, but most people do understand that. And I feel I try to do that at the level of being a commissioner of a state health department in the same way that I tried to do that as an individual provider to patients at the bedside
Yes.
when I functioned in that capacity.
I think your transparency here today, I think, speaks volumes, and all of the news conferences and all of the, as you talked about during that era, that pandemic era, where this is what we know now. You know, we're not people that have crystal balls, and we
Right.
can't predict because you don't know what direction, you know, anything is going. And I like the way you analogize that to the fiscal crisis we're in. We don't know. We hope it ends soon,
Right.
but we don't know how it's going to end. So there's a rumor floating around that maybe there's going to be an upcoming special session, and that November 12th and 13th. And so kind of wondering, what role would your department play, and are there any specific recommendations that you would want to share with the governor?
So I think that the governor's office and the legislature has been appropriately so focused on the impacts of HR 1 and being the big bill, as you described, and really the lapses in social supports to people. As we know, with the federal shutdown and SNAP coming up in a couple of
Yes,
days,
yes.
those are the types of things that are greatly impacted by that bill. And I think the focus most likely is going to have to be on those immediate supports.
Yes,
Because
definitely.
at the end of the day, public health, which is largely prevention, we largely work upstream and try to prevent things from becoming bad. When they are bad, that's healthcare.
Yes, that's right.
That's
That's right.
healthcare. And
That's right.
everybody
Yeah.
wants science when they need health care because people want to live.
That's, of course.
It's the same science that we need to provide health care and do public health, but the threats to public health are often a little bit down the road. So in the immediate
point.
future, the threats that need to be dealt with immediately are a lot of those social determinants of health: food, housing, safety, the basic things. And unfortunately, HR 1 is potentially impacting a lot of that in our state. And so that's where I anticipate that the focus will have to be. I do think that there are things that probably in the next session, hopefully, we will be able to put it off until then as it relates to public health. But the governor has been very supportive, and I have confidence that should we have some sort of crisis that needed to be addressed, that we would find a way to do that.
Thank you so much. And tell me, how can local partners, organizations like the YWCA Hartford Region and others, how can we help you get out the messages that you'd like for the public to hear?
I believe that organizations like yours are, when we talk about meeting people where they're at, you're doing that. You have those connections right on the ground. And like I said, we are not usually a direct service agency.
Yes.
So we don't have those connections on the ground directly. We do through our local health departments, who often do provide some of those supports on the ground. But I think you can help amplify our messages. You can help amplify that the state health department is a trusted source of information, and that when we put out vaccine guidance, that's something that can be trusted. When we do put out information through our partners, let's say on community gun violence or on tobacco or on other chronic disease prevention, that we are sources of information that can be trusted. Because half of what we do is communicating with people, educating people. But a lot of times people will trust partners that they know. They will trust people that they know. And helping to let people know that they can go to our website, they can look at our resources. We connect to a lot of things and help direct people to other resources if we ourselves are not providing it.
Yes.
Because at the end of the day, that's what we want. We want people to be connected in the community. And I think that you can be great partners for us to help amplifying the messages we're trying to get out.
Well, we will do just that, and we are so happy to partner with you. And believe me, we have all sorts of conversations, not only internally but externally, and so we're proud to work with you on that. So, what a remarkable journey from a young medical student now all the way up to commissioner. You've led through multiple crises. What motivated you to step into the public service, and how do you sustain a sense of purpose?
So I was at Yale for over 20 years as an infectious disease physician, a researcher, an educator, an administrator. I did a lot of different roles in academia. And when this opportunity came before me, I had helped with COVID vaccine messaging for the state during a sabbatical that I had. And for those who don't know, I got to know the governor because in December of 2020, our indoor dining restaurants were open.
Right.
And I was taking care of COVID patients in the hospital. And I could see the uptick in patients. And I could see that this was going to be difficult for us to manage this the second time around. And I signed on to a letter asking the governor to shut down restaurants.
Oh, okay.
The governor met with us, about 8 of us who had signed on to that letter, and I told him stories of patients that I took care of. Young people who were going out but then bringing the virus back home.
That's right.
And then those people were my patients. And the governor said that he wanted me to come onto one of his press conferences and tell the people of Connecticut about the stories that I heard. And that's how I got to know this administration. And 6 months later, accepted the offer to be the health commissioner. And the reason I did was it felt like an opportunity to do what I was doing in academia for a small audience, for a larger audience, but also to have purpose-driven work. And you ask what sustains me. I think that in some ways, maybe I'm best prepared to lead through crisis. Infectious disease doctors, by our nature, often come in the middle of crisis for families, for individuals. If there's a rampant infection going on, or people don't know what's going on, but they're relying on infectious disease doctors to try to figure it out. We're sort of detectives in the medical world. And I think that I get driven by the hope and promise of a better future. As I said, I'm a hopeful person. And I like to be involved in the change that's required to get us there. And this job is very purposeful. I can wake up every day and feel good about what I'm doing and good about the work that I have the opportunity to do.
So I promised you we were coming to a close, but you know, this conversation could go on and on. And I know that your time is limited, and we want to respect that. And thank you for being here today. But you've talked about being hopeful, and that just comes out of your pores. I can feel it, and I believe it when you say it, and I certainly believe it when I've seen you in action. What message do you want to leave with Connecticut residents today? Again, given all that is, we are in chaos. We are in chaos. What message of hope can you leave in a time of uncertainty?
I do feel that we have an uncertain future. We don't know how long this will last, but people do have agency. They can advocate for themselves. They can advocate collectively. They can advocate to their legislators in the State House. They can advocate to our federal partners. And we are not hopeless. We will determine the future of this country. That future is in our hands. So we can't let go of that opportunity.
Right.
And people can feel downtrodden at times when it feels like there's nothing that we can do. But we can do things, and it may take longer, and there may be more periods of, unfortunately, suffering that happen. But from that, there is always going to be a return of science, of hopefulness, because at the end of the day, people want a better future for their children, their grandchildren, themselves, their families. And if we retain that hope, and that hope is much more infectious than fear and anger. And if we let fear and anger take us down, that is not going to sustain us in the long run.
Oh, that's right.
So if we retain that hope, and I don't think that's false hope, I think that that is real hope, because I genuinely look at the trajectory of our country. I genuinely look at the trajectory of science and medical advancements that we have had. And unfortunately, I think right now we may be in a period where we're going to slide backwards for some period of time. But I want to be there to help rebuild and help reinstate confidence among people. And I hope that people feel that they can trust me and that they can trust our government in Connecticut. I feel grateful to live in a state where I can say that and I feel that.
Absolutely. We
And
say that often here. Well,
yes, absolutely. And I feel that if people can retain that hope and work with that promise, then everybody together can help get us in a better trajectory than we even were before.
I can't think of a better way to end this program. And thank you, Commissioner, for your service. Thank you for your leadership. And thank you for being the hopeful person that you are.
Thank you so much. It was a pleasure to be here today.
So to our viewers and our listeners, this is your time to act. Call the legislators. Support your local public health organizations. Volunteer. Let your voice be heard. You can be a part of the solution. Our next YW Live Lunch and Learn features Susan I. Hamilton, Interim Commissioner of the Department of Children and Families, in bringing our children home. Until then, stay informed, stay hopeful, and thank you for listening to YW Live Lunch and Learn. I'm Adrienne Cochrane. Have a good rest of your day.